I met Yvonne Donaldson when she was 8 weeks pregnant. Her other doctors couldn't quite believe it. She was over 40 and had almost no working organs in her body. She'd had a lifetime of diabetes and hypertension, and it had left her with kidney failure, strokes, and a whole bunch of other diseases. She was on dialysis 3 times a week, and yet here we were, with a small, flickering shape on ultrasound. I'm a high-risk pregnancy doctor, so this is what I do for a living. Sometimes I work in the hospital and deliver babies. Sometimes I work in the office and diagnose fetal problems on ultrasound. Sometimes I work on the front lines of the COVID-19 pandemic. But in all those places, I take care of high-risk conditions during pregnancy. Whether those problems were caused by the pregnancy, whether they were there at the start of the pregnancy, or surprise us in the middle of the end. And that year, Yvonne was one of my sickest patients. In general, I will never counsel any patient towards the termination of pregnancy if that pregnancy is desired. I'm going to only recommend it if I really, truly think that there is a chance that this woman will die because of this pregnancy. But Yvonne's body was barely managing day-to-day function. Her pregnancy was risky, and any delivery almost definitely life-threatening. And then there was the fetus. Yvonne was on multiple medications that were terrible for developing eyes and developing brains. And nobody had ever discussed changing those medications because none of her doctors, the one she saw 3 times a week at dialysis, had ever thought of her as somebody who could become pregnant, as somebody who had sex, as somebody who desired and was desired. So now, at 8 weeks pregnant, I had met Yvonne twice. I had met her husband. I had seen her teenage daughter sitting in the waiting room. When I finally gathered all the information that I could about her besieged body, I told her what I saw was the truth, that a path to an actual baby was narrow and that we might well lose her along the way. I recommended that she think seriously about ending the pregnancy to save her own life. And she smiled at me the way someone smiles who's been told she's going to die by many very educated people for many years. And she said, "Dr. K, no offense, but ain't no little thing gonna happen." And after each of those hours-long sessions with her and her family, feeling that she didn't take me seriously, I would drag myself back to my office exhausted. I would say to my fellow doctors, she's wrong, because every little thing is going to happen. Every little thing. And as it turns out, we were both wrong and we were both right. For a long time, the title of my book was "In Yvonne's Honor, Every Little Thing is Going to Happen." Not the title now. Yvonne's pregnancy progressed and Yvonne got sicker. Her blood pressures became difficult to control. Her sugar values for her diabetes were low, then high. We changed her dialysis to 6 days a week to help clean her blood and give her pregnancy better odds, but those hours were attached to a machine and they took their toll. Yvonne was 24 weeks pregnant when we admitted her to the hospital. And ordinarily, at that time in pregnancy, a pregnancy can have a chance of living outside the uterus. But Yvonne's pregnancy had never grown well. The uterus and placenta had the same problems that the rest of her body had, weren't getting enough blood supply. And so Yvonne's 24-weeker looked more like a 20-weeker. We'd have more long and complicated discussions with Yvonne and the pediatrics team, and we decided just to not check on the pregnancy too often. We couldn't deliver her. The fetus wouldn't survive, so we just didn't want to look. During that time, we checked the fetal heart once a day, and Yvonne knew that every day we could look for a heartbeat and find none. A pregnancy that finally received too little oxygen, too few calories to continue on. But then 25 weeks passed, and despite the difficulties, when we began checking 3 times a day, there was always a fetal heartbeat. 26 weeks passed, 27 weeks passed. At 28 weeks, the fetus finally measured 500 grams, about a pound, close to what an average 24-weeker would weigh. And based on those conversations with pediatric team and with Yvonne and her family and what they really truly wanted, we decided we would start fetal testing on this very compromised pregnancy. On her first day on the fetal monitor, Yvonne's monitor looked terrible. It looked like a fetus that was not getting enough oxygen. Nobody wanted to end up in an emergency delivery with this ill patient. So we spent the day mobilizing for a cesarean with our anesthesia, critical care, pediatric, and other teams ready to go. Yvonne went to the operating room. She went all the way to sleep because her heart function made it dangerous for her to get the spinal anesthesia we usually use. The team made a large vertical incision on her belly. When we got to her uterus, we bivalved it open like an oyster shell to give this tiny baby the gentlest possible trip out. The baby was handed gently to the neonatology team, who put the smallest tube they had down her throat. They wheeled the baby to the NICU. An hour later, we wheeled Yvonne, still asleep, also with a tube down her throat, to the adult ICU. And at that time, we weren't sure if either of them would make it out. Yvonne had a rocky course in the ICU. She was hard to manage. She needed to be given fluid because without it, her damaged heart did not pump well. When we gave her fluid, her lungs would fill up with water because she didn't have functioning kidneys to filter it. It was a roller coaster of dialysis, blood pressure control. There was infection and possibly a clot in her leg. There were a couple of terrifying nights where really all the ICU team could do was just to keep her vital signs close to normal. And a couple of nights where we weren't sure we were ever going to be able to wake her up. But a few days later, things started to get better. Yvonne's breathing improved and her breathing tube was removed. A week or so later, she came out of the ICU and back to my postpartum floor among the high-risk pregnant women. A long while after that, she was discharged home to continue her dialysis and medical treatments. Even with that long hospital stay, she stayed much less time than the baby. The baby was one of the smallest in the ICU, the neonatal ICU, despite her somewhat advanced gestational age. And I used to see Yvonne being wheeled in to visit the baby. We would hug and exchange updates. Yvonne's heart was stable, but the baby's was worse. Yvonne's sugar was going crazy, but the baby's was finally under control. By the time Yvonne was discharged, the baby had all the complications of the extremely premature. She had breathing issues, nutritional challenges, infections. The baby had what looked like a stroke, and then, on imaging of the head, there were moderate signs of brain damage. Maybe because of the stroke, maybe because of the stress she had been surviving under before she was born and after she was born. The baby needed one surgery and then another. 4.5 months later, the baby did eventually get discharged, alive. I don't know what her life has been like since then, and I can't know what her life will be like in 10 years. I do know she was alive when I wrote this. So you see, ain't no little thing happened. A mother went home and a baby went home, both alive. And yet, in the middle, every little thing happened and continues to, as it does every single day. Thank you.